Hello and welcome to Smartkarma's corporate webinar. I'm Sanam Nanwani from Smartkarma. This week we are hosting UMP Healthcare. We are glad to have with us Chief Investment and Project Officer, Mr. Patrick Cheung. We will start the webinar with Patrick walking us through a company presentation, after which he will engage in a fireside chat with Smartkarma Insight Provider, Taneja. We are taking live Q&A, so I would like to request our attendees to post your questions in the Q&A tab at the bottom of your screen. During the webinar, we will also share some links on how you can connect with UMP Healthcare and read more research by Samir. So please do keep a lookout for messages in the chat box. I now hand it over to Patrick to walk us through a short company presentation. Patrick, please.
Hello, I'm Patrick, the Chief Investment and Project Officer of UMP. Let me have a quick introduction of the company. Our agenda for today is the group overview, and then we will share some of the latest development of the company and to share the market opportunity about the healthcare industry. Let's look at the company profile. We are a Hong Kong leading private medical service network founded in 1990s. We have over 1,100 service points and have served 1.1 million patients every year. And we have served a lot of insurance and corporate companies and served over 1 million scheme members in past years. Let's see what we do in our financial performance. Our financial year is 30th of June, and in last June 30th, 2022, we have a record revenue of 666 million Hong Kong dollar, and have the EBITDA have 167 million Hong Kong dollar. Giving a net profit of 72,000 million in Hong Kong. And our earning per share, 9.34 cents in Hong Kong, and dividend payout is 4.5 cents in last financial years. Our EBITDA per revenue is 25%, net profit margin is over 10%. And let's see our interim result in last December 31st, 2022. We record a revenue of 365 million, EBITDA of over 100 million Hong Kong dollar, record a profit of over 40 million Hong Kong dollar, giving a 1.7 cents interim dividends in last interim result. We have a cash with over 280 million Hong Kong dollar, giving the EBITDA per revenue increase from 25% to 20%, net profit margins improve from 10% to 12%. And our business model is quite simple. We mainly have three sectors. One is the corporate scheme solutions. We are serving a lot of insurance and corporate company for providing healthcare solutions and supporting the TPA service. Besides that, we have the clinical service in Hong Kong and Macau, providing the general practice and specialties medical service and imaging lab, and also the dental service. We also have the clinical service in PRC, mainly in Beijing and Shanghai, and also having the service in Macau, mainly for the medical examination and the clinic outpatient services. Our medical service, we are not just a medical service provider. Besides giving the medical service to patient and the member, we also serving for the contract payer. As I say, it is mainly the insurance company and the corporations. We serve them to provide solution to the corporate payers. And behind that, we're serving their insurance members, and we pay for them and providing the solution to cover and insurance healthcare benefits to their members. At the other side, we also have serving the medical service providers. We have working with them to provide the medical service to the patients and members. On the other hand, we having the administration support to these service providers. And right now, we have a lot of service provider, including the healthcare listed group. We carry over 60 GP and SP outlets in Hong Kong. And we also working in certain specialty surgeon groups in Hong Kong and working for 2 private hospitals. Our B2B corporate healthcare solution, as I said, we providing mainly to support the employee benefit scheme, outpatient scheme, and inpatient and outpatient scheme, and also provide preventive program and dental care to have all range multi-service to all the corporate members, insurance members. We have a strong customer base, which are all well-known insurance company and big multinational corporation, and also supports a lot of property developers, cafe, MTL, and also some university, and Macau also cover the hotel and the casinos. Our service covers all range of services, which including the primary medical care, secondary medical care, dental care, surgical and dermatology services, imaging labs, and the physiotherapist rehabilitations. We have extensive service network which cover Hong Kong, Macau, Shanghai, and Beijing. Our business mix have diversified in different product mix, and geographically remaining in Hong Kong have over about 10% is coming from Macau, coming from Shanghai and Beijing. 2% is coming from Macau. In this chart, you can see that our performance in past few years is promising, and with a growth in revenue nearly 10%, and every year we're having a profit generating from our operation and have growing earnings per share and dividend per shares in past 5 years. Below is our latest developments. We have established a strategic partnership with Adventist Hospitals. It is a private hospitals. We signing the MOU in early of this years. We're working with the hospitals, and we have a lot of collaboration to work with them to build new service point, new imaging center, new medical centers. We expected all these collaboration will bring in more revenue profits to UMP in coming years. Besides Adventist, we also signing agreement with FT Life. It is a life insurance company under the New World Group members. Under the agreement, we work with the reserve for the individual scheme members, and it is our startup to work from the B2B going to the B2B and C markets. It is expected the revenue bringing from these services will growing to about 18 million a year in coming years. Besides that, we also have a lot of collaboration, including we're working with the government, negotiating and discussing cooperation with the government about the district health center. And we also, besides Adventist, we also working with Gleneagle Hospital and other private hospital in Hong Kong. And we are working with the Hong Kong British University to work about the Western medical medicine and traditional Chinese medicines integrations. And for technology, we also work with the UST about the innovation. We are designing a AI healthcare apps, and which expected will be launching the market by this year. Besides the general introduction and our latest developments, let's see what will be the market opportunity in the healthcare industry. It is obvious that in Hong Kong market, it has a high demand of medical care for the people. Based on the government's statistic, it is expected up to 2039, the elderly over the age of 65 will grow to nearly 1/3 of the populations. It means that the healthcare expenditure will also growing up for the healthcare services. It go to 190 billions in past years, and it's expected to growing further in coming years. Due to the elderly, it have much demands, especially for the vaccinations, screening for cancers, chronic illness, and other prenatal care services in coming years. Let's see for the cancer statistic. It is in the past 10 years, it has grown from 26,000 to 34,000 people getting the cancers. It is growing every year, and due to the aging population, and it is expected the demand for the medical service will be growing, especially for the imaging service. In the diagnostic imaging services, we can see that there is a long queues in the public hospitals, and but in the private sector, it has limited market players. And for the number of appointments waiting in public hospitals, it has a long queues. Many of them need to wait for over years. And you can see at the right-hand side, there is a table showing that the non-private sectors imaging providers is limited, and is not able to satisfy the demand from the publics. So it means that it have growth, it have a good opportunity, and have great demand for the private sectors. In this table, you can see that in the past 2 financial years, we have working for our roadmaps to mass more and have more coverage. Besides the scheme solutions, we have the imaging and lab services, which growth in the last financial year grew for over 30%. We have invested more in the imaging service in order to cope with the growing demand for the imaging services. Coming, we have the 2 new centers which opened in the prime area in Kowloon and Hong Kong side. At Tsim Sha Tsui, a prime area in Kowloon side, we have our integrated imaging center with providing MRI CT scanning service in Kowloon side, which have just launched in this March or April, and is now ramping up with a total area of over 7,500 square feet. Another site which is going to launch, it is the PET-CT imaging service, which will be opened in this month at Central Bank of American Towers, will be launching, coming to contribute revenue to the companies. Besides that, we also have a great team of imaging team. We have 9 radiologists and a lot of radiographer, and with a full team of scanning machines equipments. It is one of the largest private imaging chains in Hong Kong. And we have the advantage of which cover the full line of medical imaging services, which cover the PET-CT, MRI, CT, ultrasound, fibroscan, mammograms, and the X-ray services. And we have preferred service provider repeating diagnostic, scanning, and regular checkup for the age populations. We are ready to support the government's and the public's demand for the imaging services. We have serving over 140 customers in every years. We equip with high range of medical imaging machineries. We have over 12 let's introduce the new PET-CT scan centers in Hong Kong Islands. It is a prime area in Central and 4 minutes to the subway station, convenience to the centers. And especially for the scan CT market, it has a great demand in the private markets. We will continue to invest in the imaging business. As we say, it is growing aging population and more demand for the body checks and the chronic illness and the cancer demand services. We have also going to have more strategic approach for expansions. In Central, we have our service center in which providing GPSP, dental service, physio, and the wellness management. Besides that, we just acquired another center in Central area in last years. We'll also provide a advanced premium medical service. And also in Kowloon side, besides the Cheung surgery, we have another center in Jordan, which already providing the imaging and the day surgery services. We are expected we will have revenue growing in coming few years, which resulting from our ramping up of new imaging center. As I say, in Cheung surgery and Central, we will have further incremental contribution revenue with over 100 million in coming 2 or 3 years. And due to our business collaboration with different strategic partners, and also our task force with the government, it is expected there will be also contribution from the corporate solution and the medical service in coming year of over 140 million in coming 2 or 3 years. It is expected in the financial year 2025, our revenue will growing about 1,000 million Hong Kong dollars. That's the end of our introduction of our company. Thank you.
Great, Patrick. Thank you so much for this introduction. It was extremely comprehensive and detailed. So maybe now if I could just start by asking a few questions, and I guess first I would like to start with trying to understand what policies in the Hong Kong healthcare space, given we've had the Hong Kong healthcare blueprint, are just released, are pertinent to you, and that would help your revenue grow over the next 5 to 10 years?
Yes. I think as we mentioned in the PowerPoint, it saying that the age population over 65 will go to further 30% to 2039, and age 80 or above will further reach nearly millions in coming 10 years. So it means that there's rapid growth in the age population. So, and besides that, there is a further increase in the chronic illness populations. So the Hong Kong governments foresee that there will be growing in the healthcare expenditures in coming 10 years. So they launched their blueprints in last 4 quarters in 2022. They think that they need to have more cooperation with the private healthcare sectors. So they launched the blueprint saying that they would like to promote the primary healthcare idea to launch to the private healthcare sectors. They think that people need to have more alerts in their healthcare in earlier stage. And besides their public healthcare pressures, they would invite the private healthcare sector to play a key roles in this area. So we think that in coming 5 years, the private healthcare groups like us, with a lot of multi-services, full range of medical service, and have extensive imaging services, will have a strong advantage to how and play key roles in these blueprints developments.
Understood. Okay. So you've provided a very clear roadmap on how you propose to reach $1 billion Hong Kong dollars of revenue by FY25 from the current 665 million. And in order to do that, you've got medical imaging increasing by 120 million Hong Kong dollars incrementally, and then corporations kind of adding another 140. Can you talk about the capex that you've spent already in order to do that, and also the capex that you will be spending in the future now, given that I understand you've already come out with all these labs, etc. So are we past peak capex, and average yearly capex would be lesser? How do we think about that?
Including the 2 new imaging center, we really have 12 imaging centers in Hong Kong, which mainly situated in prime area like Jordan, Tsim Sha Tsui, Central, and the Causeway Bays. For the 2 new center, we invest about for the Tsim Sha Tsui centers, we invest over 15 million Hong Kong dollars, and for the PET-CT, we invest about 30 million Hong Kong dollars. And I think that we really have a quite competitive, extensive imaging networks in Hong Kong. And also we have a great team of radiologists. So we think that in coming 1 or 2 years, we right now currently we don't have further plans of substantial capex plans in coming 2 years. But after this, we don't know. But of course, if during these periods we find a good place or good partners, we will also consider the other imaging centers, maybe in other geographical areas in new territories, or some area like closing the cross-border area, we may consider. But right now, we don't have additional capex plans in coming 1 or 2 years.
Understood. So sustaining capex for you, like, a regular capex every year would be broadly how much, just for people to know?
In our medical services, besides the imaging center, which need to invest for the medical equipments, most of our medical centers is just mainly some renovations, nights, not need to have substantial capex investment. So basically, we don't have substantial. Maybe every year is only have a few million Hong Kong to 10 million Hong Kong dollars capex every year.
Okay.
Yes.
So is it fair to assume now we kind of trend back to a sustaining level capex, given that all this investment is more or less complete for your medical imaging centers, etc.? And of course, this excluding the fact that obviously you would have opportunities that arise that you, as you mentioned. I mean, so if that were to be taken out of the equation, and we just consider, the investments that you've currently made, there is not much capex required in the future.
I think in past 12 months, we spent nearly 100 million capex.
Yes.
So right now, we are more focused to consider any M&A opportunities.
Understood.
Because imaging is already have a good networks as management things, and we need to building ramping up the imaging center and let them to operate more efficient, more effective, to then have more collaboration with business partner, and to serve for the government's booking plannings. So incoming, we right now don't have much capex spend, but we will looking for M&A opportunities.
Okay, and staying on that slide, 665 million, you had a profit of 70 million,
Yes.
net profit margins over 10%. And now as you transition towards $1 billion Hong Kong dollars of revenue, with these new revenue streams, I guess everyone would probably like to understand how these would incrementally contribute to margins, specifically the medical imaging side, because that's, as we understand, higher margin business. So maybe if you could sort of give us an understanding of what margins could potentially be there, and where you see companies' margins trend over the next few years, that will be great.
If go back to the 2022 financial year, if we see that the EBITDA per revenue, it is about 25 to 28% profit margins. And I think, as you say, if we look at the EBITDA margin, I think that it will increase it, because the new imaging service it is more profitable than the normal medical service and the corporate healthcare solution. So in general, we expected the coming EBITDA profit margin will growing maybe over 30% or more, depending, because the PAC City also has high profit margins sector imaging services. But because we have invested a lot in these years, so the depreciations and the new center rentals will come up more pressure in the expense sides. So I think that the net profit margins after deducting the depreciation will be similar, around 10% or 10 something, we guess. Because even we have higher EBITDA profit margin, but we also have higher depreciations in coming few years.
Okay, got it. Okay, so there'll be an offset through depreciation, but broadly speaking, if we were to look at it on a operating margin basis, right, and your net profit margin, what we're saying is essentially you'd be similar-ish in terms of where you are today for net profit margin.
I think especially as we just invest in the two new centers, just invest in the first years, the pressure to the net profit margin will be higher. But once the centers running smooth and more efficient, I think the overall net profit margin will improving. So in coming just first years, it may be about 10 or 10 something. But after a ramming up for 1 or 2 years, then it is expected the net profit margin will improving, maybe going to 12 or 15, I guess.
Right. Okay, understood. What roughly are payback periods for your investments, you think, broadly for the MRI and PET scan? I mean, how I guess it's if you could put a number on that, that'd be great. I mean,
I think
that's come from the audience, so I'm just sort of
for PET-CT, it is faster because it's more high profit margin. The demand in the markets, especially in private sectors, it's more demand, so it's faster to cover the investments. I think for PET-CT, it should be around 2 to 3 years. 2 to 3 years will cover the investment costs. But for the our integrated imaging center in Cheung, because we need to invest MRI, CT, mammograms, it is more general health check services. The payback period will be longer time, but it's about 4 to 5 years, 1 or 2 years more as compared to PET-CT.
Right. Got it. Understood. Okay. And besides MRIs and diagnostics, we've walked through a few of your initiatives, but maybe if you could just sort of give us color on each of them individually and what you're expected to add, that would be great, because you're doing so many things, these cooperations with Better, with Human. So, and then there's Adventist. So if you could just sort of broadly sort of put them in buckets and help us out understand like how each of these things kind of help you, that'll be great.
I think we will take our advantage of extensive experience in the corporate healthcare solutions. We have built it for over 20 to 30 years. So we have collaborated live with a lot of strategic partners like Human Health and Adventist hospitals, PECTA, as a well-known surgeon groups. It is expected we are building a more holistic and full range of medical service platform, so that we will have more competitive in our provision of corporate healthcare solutions. So it is expected after this lineup, we have more collaboration, more revenue generating from the corporate healthcare service, and also driving more new patient source for our medical service. So it is expected, as I say in the diagram, in the PPT, it is expected in coming 2 years. I think this strategic platform will show the synergetic effects to bring in more revenue and patient source among the strategic partners, which brings more revenues to the groups and have more competitors to support our corporate healthcare solutions business units. So it is expected it will drive in more revenue, over 100 million Hong Kong in coming 2 years, I guess.
Right. Okay. All right. So on the broader macro side, we've been hearing of a lot of departures of companies and corporations and MNCs from Hong Kong. Like, how do you think this would affect you, or do you think that you've already got a lot of deep relationships and and new ones forming. So maybe if you could give us a little bit of color on this, that would be great. Patrick, you're on mute.
I think that after the COVID, even a lot of people live in Hong Kong in past 2 years, but they think that made in China still like attractive place for the business. So we still found that some of the companies still moving back, and more opportunities from China coming out to the Hong Kong. So we expected the medical service demand in Hong Kong still growing, and people, especially the individual healthcare solution, is not well developed. So we expected the B2C market will be the growing drivers in coming years. Many people, especially when they go getting old, they're looking for a better coverage healthcare solutions. So as I say, due to our strong experience in B2B market, we have the competitive advantage to design a good healthcare solution for the individual markets. So we think that these sectors will have a strong growth and promises to contribute revenue and profits to the companies in coming 2 years. Maybe it bring to 50 or 80 million revenues we expect us.
Right.
But this market, all the individual will having higher profit margins than the B2B markets, and we expect all these. We have these competitive advantage because we have a extensive experience in the B2B market. So we know the tricks about the insurance arrangement. So we expected we will get these sectors in coming years.
Understood. Another question, I guess, on challenges to be faced by the company is on the challenge to recruit and retain doctors, specialists, and radiologists. So is there going to be like a high inflation on wages, and what's your view on the cost base for the next 2 years?
Yes. Yes, actually, in the past years, some of the doctors have leave Hong Kong, and even in public sector, they are also looking for doctors. So the governments have already started the communication with overseas doctor, and on the other side, they also are working with the mainland China's, because in mainland China, they also have a great pool of experienced specialties doctors. They have well-trained, but they need some time to know the Hong Kong market. So I think this group of doctors will have the advantage because they can serve for the mainland China medical service market and also in Hong Kong market. So these good doctors will support and fill up the shortage of doctors in Hong Kong, and it can help us to develop the mainland China's medical service markets. And for the radiologists and specialties, because we have a full range of service, and also for the imaging center, we have a lot of imaging center, and we have a full range of different machineries, and we have a great team of radiologists. So it will be the advantage for attracting good radiologists to join us, because they can have more chance to know different imaging service and have more opportunity to operate different imaging equipments. So we have a good side to recruit more radiologists, but of course we need to have pressure in the staff force to retain doctors.
Right.
And some of the doctors, especially in the specialties and radiologists, it is basically we have the basic package with some profit sharings. So it is expected we will have more revenue pool, and this means they also have the high sharings of the revenue. So it may be a good sign for us to competitive with our competitors, because we have greater pool of revenues, and even they have sharings because we have the pool of revenue. It didn't have much pressure to the overall profit margins, because we have heard that some of the imaging centers, they need to operate for a few days, for a few working days, and then they need to stop for 1 or 2 days because they have shortage of radiologists. But for us, even we have over 10 imaging centers, we don't have this stopping or suspending the working days situation. So right now we still have adequate radiologists for running our centers.
Right. Great. So Patrick, we talked about the pillars of capital allocation.
Yes.
We talked about M&A. We've talked about CapEx organically. Now, just to understand, because you've got almost 45-50% of your market capitalization in cash.
Yes.
How do you think about dividends and buybacks, which are the other side of capital allocation? Do you have a buyback program? Do you hope to instill one if you don't? And also, how do we think about payout ratios?
Of course, we are a servicing company, and we are a cash generating business, and we have a positive operating cash flows every day. So we generate and holding a lot of cash. And besides the CapEx investment, or even for the CapEx, we still have a strong financial position to support our investment plans. And of course, we will support our share price. We have considered some of the purchase plans to support the share price, but due to the things trading volumes, and we are working in and providing good return to the shareholders, we are normally maintaining a good dividend payout policy. In the past 2 years, we really pay out over 40 to 50% of profits, within having a dividend yield of over 6 to 8% in the past years. So I think this dividend policy, unless there's other plans, I think it will be maintained, or even it will be more aggressive to have more positive return to the shareholders. And of course, we are not like to stay in the existing situations. We were looking for more M&A opportunity in order to help for the corporate developments. So we were looking for opportunity to spend the money to generate more money in futures. So I think for shareholders, they don't need to worry. We are working forward to develop the business.
Understood. Okay. Another question, I guess, from the audience is, we have about 2,000 corporate contract customers in Hong Kong. So if we were to look at the total addressable market, what have you covered potentially so far, and what's your market share in the, in other words, what's your corporate market share in the corporate healthcare solution side?
Yes. And I think in the corporate healthcare solutions, it mainly provided by 2 or 3 big companies. One of it is UMP. The other is Cheung Health. They are running the corporate healthcare solution under the name of Dr. View, and but they don't have the detailed TPA service, and they have the insurance background because the major shareholder is China Life Insurance. And another one is the Quality Healthcare. It is under the Bupa groups. It's also another major shareholder is a insurance background. So for us, we are more neutral to the other insurance company. So most of the major insurance company, they're more willing to work with us. And also because we have a full range of healthcare service, and we are more committed, and we have full range of service. We know clearly how the insurance product is working. So actually, every year we still have the growing of new customers, new corporate customers. And in this year, we are working with some insurance company, a new customer of insurance company. So we still have the competitive strength to attract more corporate customers. And besides the insurance companies, some of the big corporations, they also want to have better healthcare benefits to attract, recruit, or retain staff with a reasonable staff welfare benefit cost. So we still have growth in having these new corporations, new customers in past years, and we are still working for some of it. And we expected we also have on and on have new customers from insurance and corporate customers. Yes, we are confident.
Great. Look, great. Thank you for spending all this time with us and enlightening us on your company and the growth path. It looks extremely exciting, with more than half the market capitalization in cash and 50% payout ratio with a 6-8% yield, and 10-15% growth CAGR, with an improving margin profile after maybe 1 or 2 years of investment. This sounds like an extremely exciting prospect, and we wish you all the best in your endeavors for the future. And thank you so much for giving us your time today.
Thank you. Thank you.
Thank you. Thank you, Samir, for some very interesting questions, and a big thanks to Patrick for a detailed insight into UMP Healthcare, the challenges in the sector, and the opportunity for UMP Healthcare. I would also like to thank our attendees who joined the session live. With that, I would like to wrap up this week's corporate webinar. Thanks again, everybody, and have a great week ahead. Thank you.
Thank you. Thank you very much.